Welcome to this presentation on the Weight Management Clinic at the University of Liverpool. So, how does our clinic run? If you wanted to refer your pet into the Weight Management Clinic because they are overweight, then please contact your own veterinary surgery. Your veterinary surgeon will then contact us at the clinic to arrange referral for your pet. If you are the veterinary practice, then please download a referral request form from the site using the links below. That form can be emailed to us or downloaded from the Liverpool website and faxed over as any other referral case. Before the appointment, the clinic nurse will contact the owner and discuss through the clinic on the telephone, and during that time we'll arrange an appointment for the animal to attend. There'll be an information pack sent through the post which will contain various documents and information on the clinic itself. You receive a letter confirming the date and the time of the appointment and all the information required. You'll also receive a document with directions to the clinic. You'll have an information sheet explaining how the clinic works, an information sheet explaining how the DEXA scan works, a consent form, and a questionnaire to complete if not been already asked to do so with one online. You'll also be sent some sample pots. This is to request a urine sample and a fecal sample. Obviously, if you have any concerns about obtaining these samples, then speak this through with your clinic nurse. On the day of the appointment, the initial part of the clinic will be spent with your clinic nurse, and they will go through the diet and exercise history for your pet. That information will be taken from the questionnaire that you've previously completed, and we can discuss through that in greater detail. What we're trying to find out is as much information about your pet, so things that they like to play with, the exercise they do, things they like to eat, their general meal that they eat every day. We'll also weigh and take measurements from your pet and perform a body condition score. The second part will be with Dr. German, and he will take a medical history and perform a physical examination. So with weighing your pet, we do calibrate our scales, so we know that the animal is being weighed and the weight that it's showing is correct. We also body condition score. This is really about getting hands-on, and what we're trying to do is assess whether we can feel an outline of a ribs, feel a waist, see if there's a tuck there, and this helps us with assessing how overweight the patient is. We take measurements, so we'll be looking mainly at chest, waist and neck measurements, but we do take other body measurements as well, and we compare them obviously throughout the weight loss program. The medical history and physical examination is performed by Dr. German, and what he's doing here is trying to gather as much information about the animal's history and background and any previous treatment the animal may have had, and also to ensure that they are fit and healthy on the day of the appointment. Once the animal is admitted into the hospital, we'll then take further photographs, take a video of the animal walking, blood pressure, blood sample and the DEXA scan. And here are some pictures that we take in the consulting room. These are the before pictures of a dog that attended the clinic. These are the pictures taken of the same dog after the weight loss. And these are taken by a board once the animal is admitted into the hospital, and these have 10 by 10 squares, so you can really see the difference before and after. We take the bloods from the jugular vein and we're assessing lots of different things. We take a biochemistry and a hematology. So with the biochemistry, what we're looking at is enzymes related to liver and kidney functions, and with the hematology looking at red and white blood cells. In dogs we also check the thyroid function as well. We then perform a DEXA scan. The animal needs to lie completely still and on their back for this, so they do require a sedation. However, the DEXA scan itself should only take about 4 to 8 minutes approximately, dependent obviously on the size or the breed of the pet. The sedation is then reversed and the animal still goes home with the owners the same afternoon. And you can see here there's before and after pictures of the dog on the scanner. And the figures below, the main ones that we're looking at is the body fat percentage, which is 45.4% in the before and 35.1% in the after. And these are the figures that we'll talk through with you and discuss and explain what they mean on the day. So then once all the investigations have been done, we meet back with the owner and we'll go through all those results with them. We'll talk about dietary management and we'll obviously advise on the most suitable and appropriate diet for that individual pet. This all relates to the information we'll have gathered earlier from the questionnaire, so finding out things like whether the animal prefers dry or wet food or a combination of the two. We'll talk about lifestyle changes, so that may mean the way that we exercise the pet, the times that we feed, and we'll also chat through using diaries and obviously weight charts to complete at home and at the clinic. The diaries themselves, what we tend to do is ask you to fill in day-to-day sheets, so writing down what you feed, what the animal eats, what type of exercise they do, and then we can monitor that at each weigh-in. You're then sent home with the diet food, so as I say, whether that may be dry or tinned or both, and the first pack that you're sent home with is free of charge. You're then provided with a weight pack with all the information from the day written down. You'll have your day-to-day diaries. The pictures that are taken of the animal before are then sent out after the day of the appointment. And obviously, hopefully, a very positive outlook from all the information you'll have received and learned through the day. We want you to feel confident in the programme that's been set specifically for your pet and hope that you'll feel comfortable in the programme ahead. The clinic nurse will then call the next day to check on the animal, check that we've obviously recovered well from the sedation, obviously that you're happy and that you've understood the plan, and answer any questions at that time that you may have. This is an important time for you and your pet starting on this new programme, and we want you to feel confident with your clinic nurse. Make sure that you have contact details so you know who to contact and when to contact should you have any questions. We'll then weigh the patient every 2 weeks. This can be done at the weight management clinic or at your own veterinary practice, obviously dependent on how far you have to travel or what's most easiest for yourself. During that time though, the animal will be weighed and body condition scored. We'll also check the diaries and fill in out your weight charts. We may take photographs and also we'll ask you to complete a follow-up questionnaire. That's generally done obviously if you attend the clinic, but that can be sent out via email or in the post. Here's some pictures of Clarence, who was actually our very, very first cat, our very, very first patient enrolled at the clinic now 10 years ago. And you can just see some progress shots there of Clarence through the weight loss programme. And some charts. So here we're looking at the weight loss and also the body measurements, so the chest and the waist. And these are nice for the owner to see and monitor the progress of their pet throughout. And then once target weight has been achieved, the whole initial appointment is repeated. So we repeat the photographs, so obviously you have a before and after of those. We repeat the blood and the urine tests. We repeat blood pressure measurement. we repeat the DEXA scan, and then we talk about switching to a maintenance plan. Now this may be that the animal stays on the diet they're currently on, and we just feed at a higher level to maintain the weight that they've lost, but that will be all discussed after all those final investigations have been done. And here's a copy of some pictures. So this is how you will receive the pictures of your pet once they've been through the weight clinic. So you'll have a before set and an after set for you to keep. And thanks for listening. And if you require any further information, please look through the site that tells you lots more information about what we do at the clinic and also contact details for you to get in touch. Thank you.